And joining us now to dive deeper is Dr. Kevin Stevens. He is the Chief Medical Officer at United Healthcare of the Mid-South. Thank you for joining us, Dr. Stevens. My first question for you is New York opening movie theaters and easing nursing home visitations. Is it too soon? Better yet, is it safe?
Yeah, well, that's a tough issue because you have to look at each case individually, and you have to look at the prevalence of the virus in the area, and you have to look at the prevalence of people getting vaccinated. But that's the main thing now. We have a vaccine that is 95% effective against getting people, not necessarily from getting the virus, but from dying from the virus. So that's the main point that we're trying to highlight today, not only the mask and social distancing, but also get vaccinated.
Well, speaking of getting vaccinated, the future of the Black community when it comes to COVID vaccines, are you noticing that the hesitancy is starting to ease?
If the past is a prologue, then what we know from the flu vaccine, the influenza, is that about, I'll say 36 to 37% of African Americans received the flu vaccine. That's compared to like 46 to 47% of white Americans. So we know the uptake in the African American and the Latino community is significantly less. And so we really have to get the word out to say, that it's that we have to get vaccinated because that's a way that we can climb out of this pandemic.
And speaking of climbing out of the pandemic, reports have already shown that the majority of Black and brown people are frontline workers. So if there is still hesitancy, how do we get to herd immunity?
Well, but the first thing, I think we have to understand the big picture here. And the big picture here is that, as you said earlier, 500,000 Americans have passed away. And we know that in the African American community, we have a significant increase over other races in terms of mortality and morbidity. And part of it is from all the things that we know about obesity and diabetes, hypertension, and it uncovered some of the inner workings in our community, in our health status and health disparities. And so I think when you're looking at the health disparities in our communities, you see that we have a higher prevalence. And so that will really get us to get out to get get the vaccination because of this higher prevalence, because we have a higher death rate.
Got it. Dr. Kevin Stevens, do you have any other words of advice? We probably have about 30 seconds for our viewers.
Yeah, this is a very good thing. Well, what we at United Healthcare have done, you can go to our website, uhc.com, and we have a locator. So if you want to know where you can get vaccinated, go on our website, uhn.com, and then you can put your zip code in. And when you put your zip code in, it will give you the latest in terms of state and local health departments and where you can get vaccinated. And then you should talk to your provider. Look at the risk and benefits and talk to them about the potential adverse reactions. And I think that you should do like even myself. I have been vaccinated because I know of the real benefit of getting vaccinated as opposed to getting the virus.
Absolutely.
And so go to uhn.com, put your zip code in, and then you can find where you can get vaccinated if you choose to do such.
Dr. Kevin Stevens, friend of BNC, thank you so much for joining us, sir. Have a great afternoon.
And thank you. You can call me anytime. I'm always here to help.
We will. We'll take you up on that offer.